This is your average patient. Your average patient knows the procedure in which it takes to get your blood drawn. The average patient trusts the phlebotomist. And the average patient also knows the procedure or has had their blood drawn before. This is a difficult patient. The difficult patient may have a fear of needles. The difficult patient also may have never had their blood drawn before. Or the difficult patient is a hard stick. Let's take a look at our requisition. No! It's Archibald T. Rex, a well-known difficult patient, and he needs a CBC, an iron test, and a PTT. Well, let's not stand around. Let's enter the room and introduce ourselves. Hi, my name is Dana Wilson. I'm from the lab, and I'm here to draw your blood. Can I... That's a promising sound. It's safe to say that certainly Mr. T-Rex isn't happy to see you. You ask him if he consents to having his blood drawn. He consents begrudgingly. So let's get started. Whoa, wait a minute. Before we stick it to him, let's take a moment to consider asking the patient if they had had their blood drawn before and if they know the process. Asking the patient about his or her drawing experiences. And is the patient in a comfortable drawing position? You can ask any of these questions while you work, so this won't slow you up. You tie a tourniquet and check for a vein. His arms are tiny, and his vein doesn't look too good, and honestly, while palpating, it doesn't feel too good either. But you've checked all options, and this is the best draw. During the time you've palpated, you talk to Mr. Rex, and it turns out he's actually afraid of needles. Take this time as you get your equipment ready to console him. Tell him that you will count backwards from 3 when the needle is entering the arm, and tell him that you will try to be quick. Also tell him it may pinch or sting a little, so he is prepared for any pain. Another good technique is to recommend that if the patient is scared of needles, that they look away while you draw. Having taken this extra time to console Mr. Rex step by step, he feels a lot more comfortable, though you may not see it now. Make sure you have your equipment. Your needle, your vacutainers and your vacutainer holder, your alcohol and gauze, and your tape. Now you're ready to go. Now, look away, Mr. Rex. We're ready to begin. You retie the tourniquet and have Mr. Rex make a fist. You already palpated and know right where the vein is, so stick it to him. 3, 2, 1... And done. There we go, Mr. Rex, all ready to go. Now you can tell that your earlier concerns did make a difference. As you can see, not every patient has a mental or physical disability, but sometimes they're just scared or nervous. The best part is you can interview the patient while you're getting your equipment ready, so that by the time you're ready to draw, you know how to handle the situation accordingly. And when you can't find a solution to make the draw easier or less painless, just reassure the patient, and with patience and compassion, you'll both be better off.